right, when it comes to breast cancer, we are fighting to win. And Holy Cross Health Cancer Center has a multidisciplinary team of specialists who use the latest technology.
So joining us today is Dr. Leonard. She's a breast surgical oncologist from Holy Cross Health, and she's here to discuss how you can recognize signs, reduce risks, and be your own self-advocate through this journey. Good to have you.
Thank you.
I love this crowd we've got here.
Great.
This is awesome. Okay, there's so much to talk about we want to get to. When you have breast cancer screening guidelines, how do we figure out what's right? Where does that all stand for each individual?
You know, that one's a tough one because over the last few years, different organizations have come out with different guidelines, and it's confusing for patients. The most important thing about any guidelines is having the conversation with your healthcare provider about your risk to choose the right guidelines for you. In the breast world, we keep it real basic. Starting at 40 mammograms every year, we still encourage women to do self-examinations because how are you supposed to know what your breasts look like and feel like unless you check? And do your clinical examinations each year with a doctor. Most importantly, if you feel or find something new or that worries you, have that conversation. Make sure that you're checked, and if that doctor's not listening to you, find another doctor.
There's options. There's places you can go. Yeah. All right, let's say you did that self-exam, you find something you're worried about, you see an abnormality on an exam. What do you do? What's that first and next step?
Well, first, take a deep breath and don't panic. Next, for some things that really, for patients who have cysts or that really don't seem like a big deal, you can give yourself a few days to see if it goes away. If something doesn't go away within about a week or two, call your provider. Get in there, have that examination, then they can guide you on what imaging is most appropriate for you. Maybe an ultrasound, maybe a mammogram, maybe an MRI, and then go through that process of diagnostics to know exactly what's going on so you know what path to take.
Okay. What do you say? We hear it all the time kind of about knowing your family history, and I know a lot of people may still not know their family history because mothers and grandmothers probably didn't want to talk about it. What would you say to empower them to learn that?
I think it's being willing ourselves to have those conversations with our younger women, and then it's being supportive of our elders to have those conversations with us to know that it's not a stigma, and understand the importance of family history. If you have a family history of cancer, especially in those first-degree relatives, mom, dad, sisters, daughters, that really may impact your risk and impact the screenings that you should be having. But it's about destigmatizing these conversations, making sure it's a community and that we support each other in that community.
I love that.
Anything you can do to help reduce that risk of getting breast cancer? Okay, good. Tell us what we can do, please.
You know, I always tell my patients, you worry about the things that you can change. You don't worry about the things that you can't change. You can't change your age, you can't change your gender, you can't change your family history, but we can exercise, we can pursue a healthy diet, we can reduce alcohol intake, we cannot smoke cigarettes. Cigarettes are bad. We can breastfeed, and we can encourage breastfeeding in young women because that's protective. And we can avoid that sedentary lifestyle. Sitting down is not good for us, and it absolutely increases risk.
Wow. We have I know so many of these women probably have questions for you. We do have one question from the audience. We have Thelma D. Jones, the founder of the Thelma D. Jones Breast Cancer Fund. Thelma, what is your question?
Thank you. My question is, because you reference young women, young women are getting breast cancer earlier and earlier. What can you share with us, or the young women listening, on things to do to help reduce their risk?
Well, I think the most important thing for young women is really understanding their risk. For women under the age of 40, African American women have a higher incidence of breast cancer than women of other cultures. So it's super important that these women get their annual mammograms and that they're encouraged to do so. It's also important that they know that those guidelines out there that recommend that they don't start mammograms till 50 or that they shouldn't have one every other year, those aren't the right mammograms or the right recommendations for that population.
Good to know.
And then it's those same things. Our mothers told us, do it now because it's harder to start later. Get up, exercise, eat right, drink your water, reduce your stress. All the things.
Thank you so much.
Yes, thank you so much for
Thelma,
being
thank
here.
you.
Yes, thank you. And for more information about Holy Cross Health's breast cancer program, you can always visit holycrosshealth.org.